Good day, viewers. This is a court blog reporting live from the Nigerian Institute of Medical Research for the monthly media chat facilitated by the Director General of the Institute, Professor John Oladapo Obafunwa. This month's edition is centered on prevention and treatment of HIV among adolescents and young adults, as well as testing of treatment gel to combat sexually transmitted diseases. Stay tuned as a court blog brings to you the live update of things as they unfold. Adiola Muda is my name, reporting for a court blog.
The Nigerian Institute of Medical Research, NIMR, stands as a beacon of hope within Nigeria's healthcare landscape. In recent months, it has emerged as a pioneer in public health publicity and advocacy, driven by its monthly dialogue and a collaborative mindshare with various media professionals. These sessions spotlight evolving health trends, provide evidence-based analysis of social and public health concerns, and showcase robust health research outcomes. This ongoing monthly initiative, NIMR Media Chat, was conceived by the Institute's Director General, Professor John Oladapo Obafunwa. The DG recognized the imperative to keep the public informed with critical health insights and the Institute's high-quality research findings, aiming to curb national health crisis through timely advocacy and education. The August edition of NIMR Media Chat delivered another information-rich briefing in a boardroom setting. The DG, Professor John Oladapo Obafunwa, steered the discussion towards unveiling findings on the health and well-being of adolescents and young adults living with HIV in a quest to meet up with the World Health Organization's Target 3.3 about the Sustainable Development Goal of ending the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combating hepatitis, waterborne diseases, and other communicable diseases by 2030, NIMR embarked on a critical research to assess and ascertain the health and well-being of adolescents and young adults living with HIV/AIDS in the country.
We are dealing with a population of people that come into NIMR, that we are attracting to NIMR. But at the same time, there is some level of penetration into the community to gain further insight into the magnitude or peculiarities of the problem. In dealing with this condition is also actively in collaboration with other agencies.
Following the warm opening remarks by the DG, Professor John Oladapo Obafunwa, the lead researcher of the day, Dr. Agatha David, a research fellow at NIMR, delivered the presentation on the scope, objectives, and findings of the research.
In terms of research, my research focus now is on the health and well-being of adolescents and young adults living with HIV. As the DG has said, adolescents and young adults living with HIV have the worst indices in terms of treatment outcome for people living with HIV. Number one, their testing rates are very low. Their adherence to treatment is very low. And so their viral suppression is low. What this means, there is something the United Nations Coalition on AIDS, that's UNAIDS, they have set up a goal to be met by this 2025, which is called the 95-95-95 goal. This goal states that 95% of people living with HIV should be aware that they're living with it. 95% of those who are aware that they're living with HIV should be on life-saving treatment. We call that antiretroviral therapy. And 95% of those on antiretroviral therapy should be virally suppressed. In other words, when we test their blood, we do not see the virus. It doesn't mean it's not there, but it means it's so low that we cannot detect it. That is an ideal situation because when the virus is so low we cannot detect it, they cannot transmit it. So that will help to break the chain of transmission. And you will agree with me that young people, because of their nature, they're exploratory in nature, including sexual exploration. That's when they begin to form sexual alliances. So if they are not suppressed, the chances of continuing the chain of transmission is far higher. And that's why this is an age group of concern globally, not just in Nigeria. And we did a study here in NIMR early on when we found out that our adolescents seem to be failing second-line drugs. Antiretroviral drugs are in three categories. There are those drugs we call first-line drugs. When the person just comes, these are the simplest, these are the most favorable to the body. And in terms of cost, they're the cheapest. and they are first-line drugs, and we encourage people to remain on first-line drugs. If people fail first-line drugs, because of financial constraints in the country, we can't go and do resistant testing for them, so we just change them to second-line drugs if it is agreed that they are failing. And then it is when they are failing second-line drugs that we now have to ensure that they're actually failing. So we do resistant testing, which is done here at NIMR. So we found that resistant testing is not covered by the national program, so they have to pay for it. And that is another challenge. But here we found out that a lot of our adolescents appeared to be failing. So we had to help them to do the resistant testing. And to our surprise, they were all female at that time. All of them were totally sensitive to all the drugs. That was the time they admitted that they had not been taking the drugs.
Dr. Agatha David, a director of research and a consultant pediatrician at NIMR, coordinating the Institute's Child and Adolescent HIV program, stressed that adolescents and young adults living with human immunodeficiency virus in Nigeria experienced the poorest treatment outcomes among all age groups, while stating that Nigeria is not on track to meet the UNAIDS 95-95-95 goals for 2025. Which currently pose challenge in NIMR's quest towards achieving the United Nations SDG 3.3 targets focused on ending the HIV epidemic by 2030.
The United Nations Coalition on AIDS, that's UNAIDS, they have set up a goal to be met by this 2025, which is called the 95-95-95 goal. This goal states that 95% of people living with HIV should be aware that they're living with it. 95% of those who are aware that they're living with HIV should be on life-saving treatment. We call that antiretroviral therapy. And 95% of those on antiretroviral therapy should be virally suppressed. In other words, when we test their blood, we do not see the virus. It doesn't mean it's not there, but it means it's so low that we cannot detect it. That is an ideal situation, because when the virus is so low we cannot detect it, they cannot transmit it. So that will help to break the chain of transmission. One of the SDGs, SDG 3, Target 3.3, is to end the HIV epidemic by 2030. And if we do not meet these 95-95-95 goals, then it's going to be impossible to meet that SDG of ending AIDS by 2030.
In addition, Dr. Agatha revealed that about 40% of new HIV infections occurred in adolescents and young adults living with HIV, yet testing rates in this group are alarmingly low, with only around 23.7% in recent data, a mitigating factor against the 3 yardsticks enlisted for the eradication of HIV/AIDS epidemics, which includes getting 95% of people living with HIV know their status, 95% of those who know their status should be on life-saving antiretroviral therapy, and 95% of those on antiretroviral therapy are virally suppressed.
We also look after children of mothers who are HIV positive. Children born to mothers with HIV, we look after them until we certify that they're HIV-free at 18 months, or anytime we find that they're HIV positive, we enroll them into the program. And we provide comprehensive care here in NIMR in terms of testing, treatment, checking for even resistance. And so we do comprehensive care here in NIMR. We also started an outreach to an orphanage in Ketu when we found out that they had a sizable number of children living with HIV, and it was a struggle for them to come here for follow-ups. So we set up an outreach clinic in that facility, which is still running. We were the first institution in Nigeria to set up an adolescent-friendly clinic for children living with HIV, and that was set up in 2009 and is still running.
In response to the glaring challenge of low compliance to HIV treatment models and preventive measures by carriers and non-carriers within the adolescent and young adults brackets, NIMR revealed its innovative approach that has restored positive belief and improved response from the concerned population.
Because HIV is a stigmatizing condition, and they don't want their friend to see their phone and say, have you taken your drugs? So you could say, have you watched TV today? Have you taken your orange juice? Whatever they chose, what they should be reminded with. And then this will go to remind them. It improved adherence a bit, but it was not so effective, we found. So another way of sending an SMS and they're replying. That's bi-directional. So you send an SMS and they say, yes, I have, or something like that. We found that that was more effective, the bi-directional SMS. These are the level of research. They have not been adopted by the national program, and they have cost implications. But we have done the research and it's out there to show that this bi-directional SMS is effective. And then we went further to pair it with what we call peer navigation. In other words, adolescents and young adults living with HIV, but who are suppressed, who are doing well, we serve as peer navigators to those who are not doing well. So what we did was assign 5 adolescents and young adults to 1 peer navigator. So with the bi-directional SMS, this peer navigator will call them up. How are you doing? Are you okay? Are you having challenges? Can we discuss it? And also help them. If you're supposed to come to the clinic, you don't have money, can I come and accompany you? Can I help you to get your drugs and bring it to you? We found that this combination of the SMS reminders and peer navigation was able to improve adherence. It was able to improve viral suppression.
Dr. Agatha further delved into the conundrum of mother-to-child HIV transmission while revealing that the child has the right to be informed about his or her health status from a tender age. The lead researcher, Dr. Agatha, concluded her presentation by stressing the need for sexual health education among adolescents and youth through constant advocacy and intentional orientations against premarital sexual practices such as one-night stands and transactional sex to further curb the spread of HIV, while stressing the need to focus more on improving the mental health and well-being of adolescents and young adults.
We found that 20% of the people we looked at, 400 of them, had had sex before the age of 15. That is early sexual debut. At this time, they are not cognitively ready. That's their mental processing is not ready to know how to protect themselves. So it exposes them to poor sexual and reproductive health outcomes. There is inconsistent condom use. There's transactional sex among these people who are living at home, and their parents are not aware that they're having transactional sex. There is something we call one-night stand. You meet somebody for the first time, you just go have sex with the person and you go your separate ways. These are dangerous practices that lead, to acquisition of sexually transmitted infections. They lead to unplanned pregnancies. We found unplanned pregnancies among like 15% of them, and most of these pregnancies end in abortion, which is illegal in Nigeria. Therefore, they seek this abortion in places that are not particularly sanitary. And so they have poor outcomes. This means we're doing the research, but we must translate the findings of research to practice.
On the flip side, Dr. Sabdat Ekama presented the progress report on NIMR's ongoing clinical formulation of microbicide gel to prevent HIV in young ladies and women, with a project titled Developing an HIV Prevention Microbicide Gel to Prevent HIV in Young Ladies and Women. Dr. Sabdat revealed that the clinical experiment aims to close the gap in HIV treatments among women, employ targeted drug delivery to infected patients, and develop a microbicide gel to tackle the situation.
We conducted a survey amongst key population, that is individuals who engage in high-risk sexual behavior, to assess their willingness and perceived acceptability for a future microbicide product. We were also able to assess the challenges they are facing with the currently available HIV prevention methods. We assessed their perceived affordability for a future HIV prevention microbicide, and also we assessed what they would want to see in a future microbicide agent. So all this information we gathered together, and this is going to help us in product design so that we could allow the likely end users to co-create with us, and this will foster future acceptability of the product. The research is currently in the preclinical stage amongst animal models, like I said, and we look forward to favorable outcomes, which would be a precursor to human clinical trials.
In conclusion, Dr. Sabdat stressed that NIMR is making remarkable progress in the clinical gel formulation process, as they have now successfully formulated the gel and are currently in preclinical testing with an animal model. The August edition of the NIMR Media Chat was concluded with a brief question and answer segment as media practitioners engaged the presenters with meaningful inquiry bordering on the safety of the female contraceptives, the source of funding for the treatment of HIV patients, and the specific number of children and adults living with HIV in Nigeria, as well as questions over the compatibility of the safety gel.
The drugs come from donor agencies. And if we are getting the drugs from donor agencies, talk less of additional things that we can do. Before, in the care of people living with HIV, we did CD4 count, we did hemoglobin, we did liver function tests and renal to know how their organs are doing. Like somebody asked about toxicity. We know that some of these drugs can be toxic, so we need to do this test to ensure that the body is tolerating the drug well. But now they've been removed because the funding for those are no longer coming in. And so people here in NIMR, because we're a research institute, we insist that our clients do this test so that we're not just pumping them with drugs that may be dangerous, but they have to do it with their money, with discounts here, but they have to do it. So that's why some of the, not that the government is not aware that these are efficacious, but the truth is that we're low income, well, maybe middle income, I don't know what we are, but we certainly belong to the low and middle income countries. So, so funds for some of these things are the problem. Age of disclosure of HIV status. We call it age-appropriate disclosure. And we have found out that when children, especially when they become adolescents, you know, adolescence is the age of asking questions. And if you do not explain, they just rebel and they're not taking it. But we should have started, say, from the age of 5, to begin to tell the child why you're following medicine. Because what you pointed out is a legitimate concern. Their siblings are not taking drugs and they're taking. Some parents have been innovative and all her children take drugs at the same time. Some are taking multivitamin. And those that need ARVs are taking ARVs so that everybody takes medicine at the same time. However, it's better to tell the child. So we have what we call age-appropriate disclosure. So like from the age of 5, you tell the child that you and your brethren, they are the same thing, but your cells need to become stronger. So you know those soldiers in the body that fight infections. These drugs, they're helping to equip the soldiers to make them strong to fight and all that. And then as they get older, you begin to explain further. Certainly for us, we believe that by 12, every child should know that they're living with HIV. We encourage our parents because some of them are so afraid of telling their children, especially the mothers, because HIV, mother-to-child transmission, is transmitted from the mother to the child. So it's a very difficult thing for a mother to tell her child. We understand that. In South Africa, they had a strategy where the parent would disclose unless they cannot disclose. But what we found here in NIMR is that we disclose with the parents because the parents say they can't say it. So we ask them to bring the child and we disclose together. And for all that we have disclosed, there has not been a negative outcome. The children will cry and then my phone is on every time. Night, I tell them, you can call me anytime, and the other members of the pediatric team. If you have any question, any doubts, anything you don't understand, call us. We'll try to find an answer for you. We do not say, we tell them it's an illness that requires you to take drugs every day. If you take your drugs every day, you can be whatever you want to be. You can grow to old age. However, if you stop taking your drugs, it will be dangerous. You will start falling sick. You will develop rashes. You will become very thin. People will not like to associate with you because you'll be looking very funny. But if you take your drugs, you're going to be looking beautiful. You're going to be looking healthy. And a lot of them do that. I only know of one case where a mother disclosed outside of here to her son who became very violent towards her because he blamed her for it. And that case, even though he's no longer even a young adult, he has passed 24, but they're still having challenges because of it. But these are rare. This is a rare case. So we should tell our children, because if they know why they're taking drugs, they are more likely to adhere. PrEP availability to everybody. Again, it's about funds. PrEP is for high-risk cases. The high-risk cases are people that are in a discordant relationship, especially marriage. So if one partner in a marriage is positive and the other is negative, they qualify for PrEP. People that are female sex workers or people that are engaged in high-risk behavior that are recognized, they qualify for PrEP. Men that have sex with men, they qualify for PrEP. Adolescents, by reason of being adolescents, qualify for PrEP. PrEP, like in NIMR, may not be available, but PrEP is available in one-stop shops for key populations in Nigeria. And anybody, I had a case of one of my children that was getting married, and the husband had to access PrEP from a key population center, and they gave it to him because he qualified for it. So because we cannot afford to get PrEP for everybody, it's only for the populations that need it the most. But the problem we have with PrEP is not availability, it is adherence. Even the people that need it are not accessing it. If they access once, they don't come back. So I think it's for the awareness to grow. A lot of them believe you can't just be taking drugs. Somebody has talked about that. These drugs, they will damage the body anyhow. So you have to be careful. Those are some of their concerns, the toxicity of the drugs. But the drugs have been tested over more than 10 years and they've been found to be safe and effective. So it's to keep encouraging people to use these drugs. Funding for our studies from where? NIMR funds some in terms of federal government. And then we get funding from outside agencies like the National Institute of Health in the US through collaboration with bodies in the US. We've worked with Northwestern University, we've worked with St. Louis University and people like that. And then some people have direct grants from NIH. There are also other grants. We've had Pfizer grants, we have Novartis grants, that is from pharmaceutical concerns, EMSO grants. So these grants come from various places.
Okay, there's a department in the institute, the Biochemistry and Nutrition Department, in which we have the Center for Alternative and Complementary Medicine, headed by Dr. Oluwabemiga. He actually collaborates with individuals who have claims on alternative medicine products, in which they try to help them scientifically validate those claims by subjecting these products to preclinical studies, animal model studies. At least we've had like 2. I had the opportunity to work with him on some of these products. So we've had at least 2 products or more that have gone through what we call proof of concept studies. A proof of concept study is a study you conduct on few individuals before the main human clinical trials. So that is the much I can say about what is being done to scientifically validate the claims of alternative medicine products.
Indeed, the August edition of the NIMR Media Chat was an educative session on the state of HIV/AIDS treatment and management in the country, with a clear indication of the challenge and areas of concern. NIMR continues to race towards achieving the 2030 SDG Target 3.3 with the eradication of HIV and AIDS epidemics in view. For Echo Hot Blog, this is Daniel Samson Idowu.
It has been a wonderful time with the media and health professional in the Nigerian Institute of Medical Research here in Lagos for this month's edition of Media Chat. And so many questions were raised, answers were given about the level of awareness among adolescent young adults. And the professionals, health professionals, charged the media to also take responsibility of creating awareness among these young people to ensure that we have a healthy and sane society to live in. Thank you so much for staying with us. This is where we draw the curtain today. Adiola Muda is my name. I'm reporting for a court blog. Do well to follow us on our social media platforms, Facebook, Instagram, X, Echo Hot Blog. Thank you.